If I need a doctor right now, at this very moment, does anyone know where I could find one? Or even how far I'd have to go? What if I had a broken arm, or a toothache, or heart disease, or an infection, or maybe my wife needed to give birth? Can I still find someone who could treat me? Would I have to go a couple hours, a couple minutes? I mean, if I was going to student health over on NCC campus, maybe a couple 100 feet. Point is that for us, access to healthcare is something that we don't think about very often. But for much of the world, that's not the case. Um, it's something we take for granted. This is where MSF, or Doctors Without Borders, comes in. Their French name, Medicine Sans Frontières, is what they're known as nationally, and they're a medical humanitarian organization founded in 1971. They work in communities affected by war, natural disaster, disease outbreaks, chronic neglect, and other crises. And they treat people based on their medical need alone, regardless of race, religion, or political affiliation. In 1999, they were actually awarded the Nobel Prize, the Nobel Peace Prize, for their recognition of their work and the recognition of the work of their volunteers on several continents, treating tens of millions of patients. And they used the proceeds from that award to set up the Neglected Disease Fund, which supports research and treatment for diseases that are oftentimes overlooked or just not even studied because of either who they affect or the lack of profit to be made. Growing up, one of my teammates on my soccer team was a guy named Yusuf, and he's a guy I'm still really good friends with today. Yusuf had a big scar across his abdomen, and I never really asked him what it was about because I don't want to be rude. But by the time he got older, I'd gotten to know him pretty well. I finally got around to asking him, and I was like, Yusuf, like, where'd the scar come from? And that's when he told me that in the late 90s, early 2000s, him and his family were fleeing the Somalian civil war, and as they were trying to get to safety, he took a bullet into the lower abdomen, and he, without the great work that Doctors Without Borders was doing in that area, and without surgeons that they provided, he would not have made it through the night, let alone into the United States and onto my soccer team. That was when I first heard about Doctors Without Borders and began to really admire the great work that they do. Some people might say, why should we take care of people outside the country first before we take care of people in our own country? And while I don't agree with that argument, I understand it. And what I would say to that is that in cases such as disease and especially like infectious diseases, helping someone else can also help you as well. One example would be the recent Ebola outbreak. Doctors Without Borders was one of the first ones on the scene to stop and contain the outbreak, and they did a really great job doing that. And what that means is that instead of it being a global pandemic, it's a localized pandemic. Another complaint some people have about MSF is that they're too political or too outspoken for a charity, and that I would say that what they do, probably better than anyone else, is they give a voice to people who otherwise would not have it. When you're dying or you don't know if you're going to make it through the night, it's really hard to speak up for yourself, let alone other people. And people who are so far removed they don't even have basic health care, there's no way that they can affect policy that affects them. So I think that's an important role that MSF does and a really great service they provide. The vast majority of their funding comes from private donations, not public funding. And what this means is that they can make decisions based on the needs of their people and not political considerations. Doctors Without Borders, as per the nonprofit charity watchdog Charity Navigator, is the highest rated charity in its category. And not only that, but almost 90% of all donations go straight to the services that they provide. And considering that 80% is considered to be top notch, that number is really incredible for an organization of its size. One of the most prominent examples of work they do today is the conflict in Syria. They've had over 80 field hospitals set up throughout the country to treat the wounded and those affected and collateral damage from the civil war. The Washington Post says that as many as 470,000 people have already died as a result of the conflict. And only half of those, maybe even less, are actually casualties due to war itself from fighters. Over half of them are women and children who have been affected. These are people that are totally innocent, have no say in the fighting, but they're caught in the crossfire sometimes. MSF has done really, really great work there. And even though their facilities are even targeted oftentimes, as you might have heard in the news, with some double tap attacks where they attack the hospital and then wait and then attack it again for when the first responders get there to maximize casualties. Even in face of such like circumstances as that, their amazing volunteers are still day in, day out treating people, saving lives. It's really incredible. So how can you help? First and foremost, I urge you to make a donation. Any donation is better than nothing. It's kind of a cliche, but every dollar really does count, especially when something like a vaccine can be a few cents, and $1, $2 can save dozens of lives. So really every bit does count, and whatever you're able to donate, I would strongly recommend at least considering making a donation. Another way to help is to volunteer. The organization is really built and relies on the amazing work and the incredible volunteers that they have around the world from hundreds of countries. For anyone potentially going into medicine, or if you know anyone going to medicine, I'd urge you to recommend them to at least look into it, to consider offering their skills and their expertise for a really great cause. And it's a really rewarding experience. And even people who aren't going to medicine, but are going into other skills and trades, that could be a benefit. Think about giving your time, or even just your consulting or any help that you can offer. One thing I hope to do one day is use my training in supply chain and management to help get products and people and medicine to where they need it most to try and save lives. MSF, Doctors Without Borders, is really an incredible organization. I think one worthy of your support. Thank you.